School Kitchen, Group 3. Introduction. Goal. Promote the importance of healthy eating and physical activity to lower the incidence of type 2 diabetes. Priority population. One middle school in eastern and southern San Diego County, students ages 11 to 13 and who are at risk for prediabetes. Evaluation questions. Univariate. What are the average BMI of the participants 6 weeks following the intervention? What was the average blood sugar level of the participants 6 weeks following the intervention? Bivariate. Is classroom instruction or physical activity more effective in increasing knowledge about the effects of type 2 diabetes? Do participants' attitudes about increasing fruit and vegetable consumption differ from pre-intervention to post-intervention? Multivariate. Which of the following most accurately predict successful understanding of creating a well-balanced meal?
Conceptual model. The health belief model will explain and predict health-related behaviors, addressing perceived susceptibility, severity, barriers, and benefits. The health belief model will also measure the increased consumption of fruit and vegetable servings. Sampling procedure. Non-probability convenience sampling includes accessible subjects meeting some criterion. Students at select middle schools that are at risk for type 2 diabetes. Homogeneous sampling includes those selected because of a unique trait, such as those at risk for type 2 diabetes.
Research design and evaluation design. Our research and evaluation design is quasi-experimental in conjunction with the pre-test post-test design. Recruitment for our intervention will be determined through standard BMI measurements, a pre-test survey, and a health assessment. Students from middle school number 1 who have a BMI that is proven to show a high risk of diabetes will receive the after-school intervention. These students will be our experimental group. Students from middle school number 2 who have an at-risk BMI will receive a modified intervention. These students will be our comparison group. Following the intervention, a post-test survey and health assessment will be administered to all students. Measurements. Our participant survey will include qualitative outcome questions which will stem from the health belief model, and our quantitative data which will include BMI calculations and one-touch glucose monitor results. Our independent variable will be our intervention that is presented to at-risk type 2 diabetes students, which will teach healthy eating habits, meal preparation, and encourage participation in physical activity. Our dependent variable will include a primary and secondary outcome. Our primary outcome is the average amount of fruit and vegetable servings consumed per day, and our secondary outcome will focus on BMI.
Data analysis. We did a bivariate statistical analysis where we did a correlation test determining the relationship between fruit and vegetable intake and BMI level. Here is a graph showing the different BMI levels and fruit and vegetable serving. Chart results. Based on the data, at the consumption of 7 servings of fruit and vegetable, BMI begins to decrease dramatically. Servings of fruits and vegetables from 0 to 6 show little decrease in BMI, and there's a steady decrease in BMI as fruits and vegetable serving increase. Significance and findings. 78.5% of participants were able to confidently record their daily sugar intake in grams to monitor and prevent overconsumption of sugar when meal planning. 88.75% of participants were able to organize a minimum of 3 balanced meals that corresponds to the American Diabetic Association guidelines, and 77% of participants have reported having created at least 5 well-balanced meals in the last week. Conclusion. Based off of data collected after program implementation, School Kitchen was successful in meeting its objectives by decreasing average BMI from 29.5 to 26.7, decreasing the incidence of type 2 diabetes among middle school students in southern and eastern San Diego. Average blood sugar level of the participants 6 weeks following the intervention decreased to 85 mg from 105 mg. Physical activity is more effective in increasing knowledge about the effects of type 2 diabetes. Participants' attitude about increasing fruit and vegetable consumptions do differ from pre-intervention to post-intervention. Attitude becomes increasingly positive post-intervention, and interactive classroom lessons most accurately predict successful understanding of creating a well-balanced meal. Limitations. Weaknesses, relying on participants' self-efficacy and lack of voluntary participants. Strength, pre-test, post-test survey that ensures accuracy and randomized comparison and experimental group to reduce bias.